So
Why-
do you have any questions for me?
Yeah, I do. Why specifically is the client receiving this medication?
Because the client is a type 1 diabetic and either can't produce or have decreased insulin secretions and or ineffective insulin action. This patient was admitted with a non-healing diabetic foot wound and hyperglycemia.
Okay. And what action does the medication have on the body?
Insulin regulates carbs, fats, and proteins metabolism by several mechanisms. In general, insulin promotes the storage and inhibits the breakdown of glucose, fat, and amino acids. Insulins lower glucose concentration by facilitating the uptake of glucose in muscle and adipose tissue and by inability hepatic glucose production. Insulin also regulates fat metabolism by enhancing the storage of fat and the mobilization of fat for energy in fat tissue. Insulin is involved in the regulation of protein metabolism by increasing protein synthesis and inhibiting proteolysis in the muscle tissue.
Okay. Why should you question, when should you question administering this medication?
When the patient blood sugar drops in the night, the patient may not need to take it. Patient blood sugar could drop too low. It's good to know the onset, duration, and peak. This helps to determine when to administer it or question if the patient is NPO. And for surgery, if the patient is getting dextrose containing IV fluids, and if a patient is pregnant, they can't take this medication.
They can take it?
Yes.
Oh, okay. Which vital signs must be monitored?
You want to monitor the blood glucose levels, respiratory rate, blood pressure, skin tumor, mucous membranes, the pulse ox, and you want to go by the doctor's orders.
Okay. And which physiological parameters should be monitored when the medication is being administered?
Symptoms of hypoglycemia can cause anxiety, tingling in the hands and feet, lips or tongue, chills, cold sweats, confusion, pale skin, difficulty in concentration, drowsiness, excessive hunger, headache, irritability, nightmares, trouble sleeping, nausea, tachycardia, tremor, weakness, and unsteady gait.
Oh, okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
It's important to follow the directions given by your healthcare provider. You should inject the medicine within 15 minutes before or after your meal. Have food, definitely have food before the injection, and do not delay eating. The needle must be put in the sharps container. Do not use more insulin than prescribed or more. Always check the appearance of the medication. It should be clear, not cloudy, and it should be odorless like water. And it shouldn't be thick or colored or have any solid particles.
Okay. What about the interventions that must be taught for taking it safely at home?
For taking the medication safely at home, if you think you've taken it too much, call the emergency room at once. Do not share your meds. Don't miss any doses, and don't take any double doses. Ask your provider for a plan if this happens, and be careful of taking this with other diabetic meds.
Okay. What are the side effects and potential adverse reactions?
Some side effects could be hypoglycemia, which is low blood sugar. This can occur if patients do not eat within 15 minutes after receiving the insulin. The patient can become disoriented, lose consciousness, or may not be able to be aroused from sleep, or may have seizures.
And then how will you know if the medication's effective?
Patient will show improved glycemic control. They will see lower glucose levels. It can be checked through your A1C levels also.
Okay.
Was that the end of the question? Now I'm supposed to go into the room, right?